Black Plague, 50 million deaths between the years 1347 and 1353, approximately 40% of the world population. There was no vaccine. Spanish flu, more than 40 million deaths between the years of 1918 and 1921. There was no vaccine. Smallpox, 400,000 people died each year, eradicated in 1980 thanks to 500 million vaccines worldwide. Poliomyelitis, not more than 30 years ago, polio paralyzed nearly 1,000 children daily in 125 countries around the world. Thanks to a strict vaccination process, cases have only been reported in 3 countries in the world in recent years. These are strong examples that demonstrate how vaccination is the most efficient and cost-effective action in global public health. Coronavirus SARS COVID-19, 315 million cases, 5.5 million deaths, and a collapse of the health systems. Panic and paralysis of the aviation industry, the economy, and even of the social, cultural, and sports activities around the world. Job losses, closure of thousands of companies and businesses, and governmental crisis in multiple countries. It was only at the end of 2020 that the vaccines created to eradicate this disease showed the light at the end of the tunnel. Currently, the vaccination process is halfway done, and although many countries have already achieved high immunization coverage, other regions of the world still have limited access or problems in its application. There are even countries where people's rejection against COVID-19 and other diseases has contributed to dangerously low immunization rates. The lack of unity, collaboration, and unequal distribution between countries has caused the virus to continue to spread and mutate. These mutations generate uncertainty in the world scientific community. The possibility that it could become immune to the vaccines developed so far is a latent concern. Closing the gap in vaccination and ending the pandemic is everyone's task. Global public health is in need more than ever of allies that have credibility and broad convening power. It also requires creative and simple initiatives that help organizations and governments complete the task of immunization. Strategies such as VacuNAP seek to respond in a simple way to face the organizational challenges that the COVID-19 has brought to us all. The public health of the world needs people and humanitarian organizations that can see beyond governments and private interests to promote a global movement that encourages all people to get vaccinated against SARS-CoV-19 and other diseases, and thus prevent its serious consequences. To make it happen, this movement can be developed through several strategies. 1. Promote access to vaccines for all human beings. New technologies have already made it possible to create effective vaccines against COVID-19 and other diseases. What is needed is to eliminate political, religious, economic, and logistical barriers that allow vaccines to reach everyone. 2. Convene recognized social, scientific, academic, cultural, or sports leaders and organizations to become public health ambassadors and motivate people to get vaccinated. 3. Guarantee the access of the countries that require the technology that facilitates the organization, logistics, and registration of the vaccination process throughout their territory.